A silent and invisible threat is spreading across the United States, leaving a trail of illness and fear in its wake. The culprit is Listeria, a common bacterium found in our environment, but one that can turn deadly when it contaminates our food supply. The Centers for Disease Control and Prevention, or CDC, has issued a dire warning, reporting a Listeria outbreak with an alarming 16% death rate. The outbreak has already impacted a large swath of the country, with cases reported in multiple states. This is not just another foodborne illness. It's a stark reminder of the vulnerabilities in our food safety system. We must understand the enemy, identify those most at risk, and take swift action to protect ourselves and our communities. Listeria monocytogenes, commonly referred to as Listeria, is a bacterium often found in soil, water, and even the guts of some animals. Listeria is particularly adept at surviving and even thriving in cold, moist environments. This makes it a silent stalker in our refrigerators, lurking and ready to eat foods like deli meats, soft cheeses, and prepackaged salads. Unlike many bacteria that cause immediate spoilage, Listeria often doesn't alter the taste, smell, or appearance of food, making it difficult to detect without proper testing. This infection primarily affects pregnant women, newborns, older adults, and individuals with weakened immune systems. Understanding the nature of Listeria and its ability to silently contaminate our food is the first step in protecting ourselves. The current Listeria outbreak has sent shockwaves through the nation's food supply chain, prompting widespread recalls and raising concerns about the safety of our food. The source of the outbreak has been traced back to a food processing facility in Insert State, where investigators discovered Listeria contamination in several products. The initial recall was limited to a specific brand of prepackaged salads, but it has since expanded to include a growing list of products distributed nationwide. This rapid expansion highlights the interconnected nature of our food system, where contaminated ingredients or products from a single source can quickly spread across the country. Health officials are working tirelessly to track the contaminated products, but the task is daunting. The initial contamination may have occurred weeks or even months ago, making it challenging to trace the full extent of the spread. While Listeria can affect anyone who consumes contaminated food, certain groups are at significantly higher risk of developing severe listeriosis. These vulnerable populations include pregnant women who are particularly susceptible to listeriosis, with the infection potentially leading to miscarriage, stillbirth, premature delivery, or serious health problems for the newborn. Newborns, especially those born prematurely or with weakened immune systems, are highly vulnerable to listeriosis. Older adults, as we age, our immune systems naturally weaken, making older adults more susceptible to foodborne illnesses like listeriosis. Individuals with weakened immune systems, such as those undergoing chemotherapy, organ transplantation, or living with HIV/AIDS, are at increased risk of developing severe listeriosis. It's crucial for these at-risk groups to be extra vigilant during this outbreak. They should strictly adhere to food safety guidelines, avoid high-risk foods, and consult their healthcare providers immediately if they experience any symptoms of listeriosis. Listeria infection, known as listeriosis, can manifest in a range of symptoms, from mild flu-like illness to severe, life-threatening complications. The severity of the infection often depends on the individual's overall health and the strength of their immune system. In many cases, listeriosis presents with mild symptoms that are easily mistaken for other common illnesses. These symptoms may include fever, muscle aches, nausea, and diarrhea. In more serious cases, listeriosis can invade the bloodstream, central nervous system, or other organs, leading to severe and potentially life-threatening complications. The incubation period for listeriosis can be long, ranging from a few days to several weeks. It's crucial to seek immediate medical attention if you experience any symptoms of listeriosis, especially if you belong to a high-risk group or suspect you may have consumed contaminated food. The Listeria outbreak has cast a long shadow across the American food landscape, ensnaring a vast network of retailers, restaurants, and food service providers. The contaminated products originating from a single processing facility have reached every corner of the country, infiltrating the shelves of major grocery chains and the kitchens of countless establishments. Among the retailers grappling with the fallout of the outbreak are industry giants like Walmart, Target, Costco, Kroger, and 7-Eleven. The sheer scale of the recall is staggering, encompassing a wide range of products from prepackaged salads and sandwiches to deli meats, cheeses, and even ice cream. The affected products bear various brand names, making it challenging for consumers to identify and avoid them. The recall has sent shockwaves through the retail industry, forcing companies to scramble to remove contaminated products from their shelves, issue public warnings, and manage the logistical nightmare of a nationwide recall. As we grapple with the devastating consequences of the Listeria outbreak, it's crucial to examine the underlying factors that contributed to this crisis. One of the most pressing issues is the chronic staffing shortage plaguing the food industry. The COVID-19 pandemic exacerbated this problem, leading to widespread labor shortages across various sectors, including food processing and inspection. With fewer inspectors on the ground, food processing facilities face less scrutiny, increasing the likelihood of contamination going undetected. Overworked and understaffed facilities may also cut corners on safety protocols, prioritizing speed and efficiency over thoroughness. Adding to the challenge are policy changes implemented during the pandemic that inadvertently weakened food safety regulations. These staffing shortages and policy shifts, while well-intentioned, have created a perfect storm for foodborne outbreaks. The Listeria outbreak has exposed the vulnerabilities of our food safety system, highlighting the potentially devastating consequences for vulnerable populations who rely heavily on institutional food programs. Schools, hospitals, nursing homes, and other institutions that serve large numbers of people are particularly vulnerable to foodborne outbreaks. Many schools, for example, rely on prepackaged salads, sandwiches, and other convenience foods to feed their students. If these products are contaminated, it can lead to widespread illness among students, potentially shutting down schools and disrupting education. Hospitals and nursing homes, already grappling with the challenges of providing care for vulnerable patients, face heightened risks from foodborne outbreaks. The Listeria crisis underscores the urgent need for robust food safety protocols in institutions that serve vulnerable populations. The Listeria outbreak has ignited a debate about the delicate balance between ensuring food safety and preventing food shortages. In the face of widespread contamination and massive recalls, some experts argue that allowing a certain amount of contaminated food to pass through the system might be a necessary evil to avoid widespread food shortages. Proponents of this controversial approach argue that the risk of serious illness from consuming a small amount of contaminated food is relatively low for the general population. They contend that the economic and social consequences of widespread food shortages, particularly for low-income communities, outweigh the risks associated with limited exposure to contaminated products. Opponents of this approach, however, argue that compromising on food safety sets a dangerous precedent. The debate highlights the complex ethical and logistical challenges of managing food safety in the face of widespread contamination. In the midst of the Listeria outbreak, it's crucial to take proactive steps to protect yourself and your family from foodborne illness. While producers and regulators ensure food safety, consumers play a vital role in mitigating risks. Stay informed, visit the CDC website, check local news, and follow health organizations on social media. Check your refrigerator. Examine for any recalled products. Dispose of contaminated items immediately, following health authority instructions. Practice safe food handling. Wash your hands before and after handling food. Be mindful of high-risk foods. Limit consumption of deli meats, soft cheeses, and unpasteurized milk. The Listeria outbreak reminds us that food safety is a shared responsibility demanding collective action. Protecting our food supply requires producers, regulators, retailers, and consumers working together. Producers must prioritize food safety from farm to fork. This includes rigorous sanitation protocols and employee training. Regulators set and enforce food safety standards. Retailers ensure only safe products reach consumers. Embracing collective responsibility prevents outbreaks and ensures safe food.